Today, we are going to talk about back pain, and I want you to understand one important thing right away. Back pain does not happen for no reason, and it is not just about age as many people believe. Back pain is a signal the body sends when something is not working properly, but most people ignore this signal or silence it with painkillers. The most dangerous part is that back pain becomes normal very quickly. A person says everyone's back hurts. I will rest and it will pass. But it does not pass. It may calm down and then return again and again, and every time it becomes more normal to live with limited movement, tension, and fear of bending or moving. As a doctor, I see this constantly. People treat their back for years, but do not understand why the pain does not go away. Because they are fighting the symptom, not the cause. The back rarely hurts for only one reason. Most often, it is a combination of several factors that build up over months or years. And if you do not know them and do not change them, the pain will keep returning, no matter how many massages, injections, or creams you try. In this video, we will break down 5 main reasons why back pain appears after 30, 40, or 50, and why many people experience pain even without heavy physical work. If you wake up with stiffness in your back, if pain appears after sitting, if your back hurts without a clear reason, or if you are already used to living with discomfort, this video is important to watch carefully. Because back pain rarely takes life away suddenly. It takes movement, freedom, and quality of life slowly and almost unnoticed. I want to tell you one story because this is exactly how back pain enters most people's lives, quietly and for a long time. His name was Mark. He was 46 years old. He did not work a physically demanding job. He did not lift heavy loads, and he was not an extreme athlete. He worked in an office, sat a lot, used a computer, and believed his back was more or less fine. The first signals appeared quietly. Tension in the lower back in the evening, the desire to lie down earlier, the feeling that the back was tired. Mark did not pay attention to it. He thought it was normal fatigue. After a few months, pain appeared after long sitting. He started changing positions more often, using pillows, standing up and sitting again. But the pain did not disappear, it just became background noise. Over time, the pain began to radiate into the buttock and sometimes into the leg. But Mark again told himself it was nothing serious. Maybe he sat wrong or caught a chill. He started taking painkillers and using creams, which temporarily reduced the symptoms but did not change the situation. The worst moment came when one morning he could not bend properly to put on his shoes. The pain was sharp and unexpected. He was scared, but even then his first thought was to wait it out. Examinations done much later showed the problem had been developing for years. Weak muscles, poor mobility, overload of some areas, and complete inactivity of others. The doctor explained that Mark's back did not break suddenly. It had been sending signals for a long time, which he ignored because they did not seriously interfere with life. This story matters because most people live the same way. They wait until it becomes unbearable, and only then start doing something. But the back does not like being ignored. It does not scream right away. It first tightens, then hurts occasionally, and then becomes a constant limitation. And if you recognized yourself in this story, if back pain appears after sitting, if you wake up with stiffness, or if you have already gotten used to discomfort, it means the cause is not random, and it can and should be addressed. Now let us break down 5 main reasons why back pain occurs and why it often does not go away on its own. The first reason is weak back and core muscles. The spine is supported not only by bones but by a muscular corset. When muscles are weak or inactive, the load goes directly to joints and discs. This causes tension, pain, and stiffness, especially after sitting. The second reason is prolonged sitting without movement. Even correct posture does not protect you if you sit for hours without breaks. Blood circulation worsens, muscles become stiff, and the back starts signaling pain. The third reason is incorrect movement or sudden load. When a person rarely moves and then suddenly lifts something or bends sharply, the back is not prepared. Pain appears as a protective reaction. The fourth reason is chronic stress and tension. When a person is constantly stressed, back muscles stay contracted even at rest. This leads to pain that does not always depend on movement and often worsens in the evening. The fifth reason is poor sleep and lack of recovery. At night, the back should rest and recover. If sleep is shallow or the mattress and pillow are unsuitable, muscles do not fully relax and pain remains. It is important to understand that back pain rarely has only one cause. Most often, it is a combination of weak muscles, sedentary lifestyle, stress, improper movement, and poor recovery. That is why pills and creams do not solve the problem. They only temporarily silence the signal, but do not change the cause. And as long as these causes remain, the pain will return. To finish, I want to clearly say when back pain should not be tolerated, and medical help is needed without delay. If the pain appeared suddenly and is very severe, if it radiates into the leg with numbness or weakness, if there is loss of bladder or bowel control, if the pain does not ease at night and interferes with sleep, if there was a trauma, fall, or sharp impact, if pain is accompanied by fever or sudden worsening of general condition, these are signals that require examination, not waiting. In all other cases, the most important thing is to act systematically, not occasionally. Here is a simple checklist for the next week. Every day, add at least 20 to 30 minutes of gentle movement without sharp pain. Take breaks during sitting every hour, change position, and walk a little. Pay attention to how you lift objects, avoiding sudden movements and using your legs. Support proper sleep. Choose a comfortable mattress and pillow. Reduce evening stress and allow muscles to relax. Do not constantly silence pain with pills, but observe what triggers it and what relieves it. Remember, back pain rarely disappears on its own if nothing changes. It may calm down, but the cause remains, and with each year, movement becomes more limited. This channel exists so you notice these signals early, not when your back already dictates how you live. If you subscribe, you will receive clear medical explanations without panic, without complex terms, and without myths about health after 40, 50, and beyond. Most people live with back pain for years thinking it is normal. I want you to be among those who know in time, and preserve movement, freedom, and quality of life for as long as possible.